Dr. Timothy Levine. I'm an orthodontic resident from St. Barnabas Hospital in the Bronx. I was asked to perform a laser procedure using the ilase on one of my patients who needed a gingivectomy from canine to canine on the upper anteriors. In my past, I was a general practice resident here at St. Barnabas, and I had used the lasers we have here for both soft and hard tissue procedures. I used the water lase, the easy lase, and the laser smile, and I performed a variety of procedures with those. As an orthodontic resident, I've had several patients who required gingivectomies, and I had one such patient who was available. This particular patient had hyperplastic tissue that had grown down and started to encroach on her brackets. The tissue was heavily fibrous, and she required a partial gingivectomy in order to allow her to conduct proper oral hygiene, and so we used her as a ilase patient. I anesthetized her using Tricaine topical anesthesia, which was left on her gingiva for 5 minutes. After that 5 minutes, I performed the gingivectomy using the gingivectomy settings on the ilase, cutting away several millimeters of the fibrous tissue as well as beveling the tissue, and we produced a result that should be more hygienic for the patient and hopefully prevent relapse. When her case is completed, in approximately 1.5 years, I expect to do another gingivectomy to produce a fully aesthetic result, but for now, the result we produce with the ilase should be sufficient to allow her to keep things clean and reduce the amount of hyperplasia. The laser itself was incredibly easy to use. It's very light, and I was actually very surprised by how well it cut and how little effort it took on my part. The amount of weight of the laser is minimal. It allowed for excessively great maneuverability. The lack of a wire allowed me to position myself in whichever manner I needed to. The patient during the procedure was very cooperative, mainly because she said she did not feel any pain, she did not feel any burning, she had no sensation whatsoever of the actual procedure. The procedure itself took almost no time because of how easy the laser was to use, and I hope to use it in the future as well.
Hi, my name is Celeste Guzman, and I get my braces done at St. Barnabas Hospital. And yesterday I used the laser, and it didn't. Oh, cause my gums was over my teeth, and my teeth are very small. So the laser helped it like move, like get out the way and stuff. It made my teeth look bigger. And the procedure didn't really hurt. It didn't hurt as much. It didn't hurt at all, actually. It's a good procedure. I think it worked perfect on my teeth. And after it was done, I think it helped me clean better, and it was not harmless or anything. Well, it was harmless, and I didn't bleed as much. And I think the laser is a good choice for every hospital to have.